What is chubby cheek surgery? Chubby cheek surgery, buccal fat removal, cheek fat removal, bichectomy. These are some very common terminologies and very common procedures that patients are now demanding. In this video, I'll tell you all about that. Hi, I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. इससे पहले मैं आपको सर्जरी के बारे में बताऊं, let me first tell you what is this buccal fat of pad, what are these cheek fat. So on both the sides of your cheek, in this exact area, there is something called as buccal fat of pad. These are deep fat pads located in the deeper layer of your cheeks. They are different from the subcutaneous or the superficial layer of fat. They give the typical bulky, chubby, rounded appearance of your face. These fat pads are the area which cover up the cheek hollowness and give us that youthful appearance. In some patients, these are also excessive and hence give the chubby, round or baby face look. Deep fat of pad can be removed and all the surgeries around it are called buccal fat pad removal surgery, cheek fat removal surgery, or even chubby cheek surgeries. So who are the patients and why would you need this kind of surgery? So if you're somebody who has a round face, a baby face, a very chubby looking face, if you feel your face does not have any angles, does not have any contours, it's not chiseled, then you might be a candidate for chubby cheek surgery. Now, why do I say you might be a candidate? So, coming to the next part. So, who performs these surgeries? You must look for either maxillofacial surgeons or facial plastic surgeons who can be either maxillofacial surgeons again or plastic surgeons who are trained to do procedures of the face. Now, the main thing when you come to us, how do we decide that you are somebody who needs buccal fat removal surgery? So the fullness or the chubbiness of your face might be coming from 2 to 3 sources, not just your buccal fat pad. Either your buccal fat pads are very bulky or your jaw muscle or the masseter muscle is bulky. It is very difficult as a patient alone to understand which is the procedure you will need, and hence an expert should first evaluate you and find out that which is the actual structure of the face that needs correction. Once we examine you and we find out whether you're a candidate for a buccal fat removal or masseter muscle correction, we then go to finding out how these surgeries are performed. Well, buccal fat pad removal surgeries are quite innocuous surgeries. They are safe, they're simple, but they are safe and simple only and only if performed by experts. So this procedure can be done under local anesthesia. Each side of removing this buccal fat of pad takes about 15 to 20 minutes. There is no external scar on your face or on your cheek. It is a hidden scar because the surgery is performed from within the mouth. Depending on what is the kind of bulkiness you have on your face, we remove walnut-sized or grape-sized fat from this area. And we close back the wound with dissolvable stitches, so you don't even need a specific suture removal or stitch removal visit. Well, but is it something that should be done by every person who's feeling they have chubby cheeks? No. There are some factors we need to keep in mind. Even though the risk factors are one of the lowest for all kind of surgeries of the face, yet they do carry basic level of risk factors for bleeding, for infection, for granulomas because of stitches. When done by inexperienced people, if too much of this fat is removed, then on the contrary, you might develop a very aged and a very gaunt look of your face. Hence, choose your surgeon wisely and be very sure that the reason for your roundness is your buccal fat of pad. Thank you. Follow this space for more such procedures on the face and how to stay safe and still look your best. Thank you.